Get ready for an extraordinary adventure into the realm of medicine, where we'll unveil a game-changing breakthrough that's turning the tide for countless patients. Are you ready to discover the secrets behind Eculizumab, the ultimate game-changer in medicine? Join us as we delve into the remarkable power of this innovative therapy and explore its incredible benefits in treating various conditions. But that's not all. We'll also share some lesser-known facts that will leave you in awe. So buckle up and get ready for a journey that will redefine the boundaries of medical science. Meet the C5 complement blocker, a revolutionary new treatment that has taken the medical world by storm. This groundbreaking therapy has shown incredible promise in treating a wide range of diseases, including atypical hemolytic uremic syndrome, generalized myasthenia gravis, neuromyelitis optica spectrum disorder, and paroxysmal nocturnal hemoglobinuria. With its ability to target and neutralize the C5 complement protein, the C5 complement blocker offers a unique approach to tackling these challenging conditions. But that's not all. This versatile treatment has also been used off-label to address antibody-mediated rejections in heart and kidney transplants, including pre-surgery desensitizations. Get ready to dive deep into the science behind this amazing therapy and learn how it is transforming the lives of patients around the world. Before we reveal the name of this wonder drug, let's take a moment to acknowledge the serious risk associated with the use of Eculizumab meningococcal infections. This rare but potentially life-threatening side effect can occur when the drug interferes with the body's immune response to meningococcal bacteria. It's crucial to be aware of the signs and symptoms of meningococcal infection, including fever, headache, stiff neck, nausea, vomiting, and changes in consciousness. If these symptoms occur, seek medical attention immediately. By staying informed and taking necessary precautions, patients can minimize the risk of meningococcal infection while reaping the benefits of this innovative treatment. Now it's time to unveil the name of the C5 complement blocker, Eculizumab. This powerful drug has shown incredible promise in treating a range of conditions and has even been used off-label for various transplant-related issues. Let's explore how Eculizumab works and the incredible benefits it offers. Eculizumab is a humanized monoclonal IgG antibody that targets the complement protein C5. By blocking C5, Eculizumab prevents the formation of C5a and C5b, which are responsible for inflammation and the recruitment of immune cells. This action also stops the formation of the terminal complement MAC, which can cause cell lysis. Eculizumab has been approved to treat several rare disorders, including atypical hemolytic uremic syndrome, generalized myasthenia gravis, and neuromyelitis optica spectrum disorder. In addition, Eculizumab has been used off-label to reduce antibody-mediated rejections in heart and kidney transplants. Eculizumab is administered as an intravenous infusion, and the dose and frequency depend on the condition being treated. Atypical hemolytic uremic syndrome, or aHUS, is a rare blood disorder that can cause the blood to become thicker, leading to a blockage of small blood vessels in the kidneys and other organs. This blockage reduces blood flow and oxygen supply, which can damage the tissues and organs and lead to kidney failure. Eculizumab is approved by the FDA to treat adults and children with aHUS, who have the following characteristics. The onset of aHUS is acute or chronic. The underlying cause of aHUS is either unknown or the patient has a genetic mutation in a gene that regulates complement activation. At least one of the following is present. Evidence of complement overactivation, including low levels of complement proteins or high levels of terminal complement complex, hemolytic anemia, thrombocytopenia, and elevated lactate dehydrogenase levels. The presence of blood or red blood cell fragments in the urine or other body fluids. Kidney dysfunction, including elevated serum creatinine levels or a decrease in urine output. Other causes of hemolytic anemia, such as autoimmune disorders or infections, have been ruled out. Generalized myasthenia gravis is an autoimmune neuromuscular disease that affects the communication between nerves and muscles, leading to muscle weakness and fatigue. Neuromyelitis optica spectrum disorder, also known as NMOSD, is an autoimmune disease that affects the optic nerve and spinal cord, causing inflammation and damage to these structures. Both GM and NMOSD can lead to symptoms such as vision problems, muscle weakness, and paralysis. Eculizumab has been found to be effective in reducing the frequency and severity of relapses in adults with these disorders. Paroxysmal nocturnal hemoglobinuria, PNH, is a rare blood disorder that causes the premature destruction of red blood cells. This can lead to symptoms such as fatigue, anemia, and jaundice. Eculizumab has been approved by the FDA to treat adults with PNH who have hemoglobin levels less than 10 grams per deciliter. By reducing hemolysis, eculizumab can improve these symptoms and reduce the need for blood transfusions. Off-label uses of eculizumab include the management of antibody-mediated rejections in heart and kidney transplants. Antibody-mediated rejections occur when the recipient's immune system attacks the transplanted organ because it recognizes the organ as foreign. This can lead to organ damage and even organ failure. Eculizumab has been shown to reduce the incidence of antibody-mediated rejection in some cases. Additionally, eculizumab has been used off-label for pre-surgery desensitizations in patients with highly sensitized blood. This involves administering eculizumab before surgery to reduce the risk of antibody-mediated rejection after transplantation. The approval of eculizumab was a significant milestone in the field of medicine, and it has since been used to treat thousands of patients worldwide. On March 16, 2007, the FDA approved eculizumab for the treatment of PNH, making it the first and only complement inhibitor approved for this indication. Since then, eculizumab has been made available in more than 80 countries, bringing hope to patients with rare blood disorders. The approval of eculizumab marked a new era in the treatment of PNH and other complement-mediated disorders. Its ability to reduce hemolysis and the need for blood transfusions in PNH patients has significantly improved their quality of life. Furthermore, its effectiveness in reducing the frequency and severity of relapses in GM and NMOSD patients has revolutionized the management of these conditions. As research continues to explore the potential applications of eculizumab, it is likely to play an increasingly important role in the treatment of other disorders. Overall, the approval and widespread availability of eculizumab has had a profound impact on the lives of countless patients and has advanced our understanding of complement-mediated disorders.